This is part 3 of the physical exam chapter, and we are beginning with the assessment of the patient. As you know, our physicians have to do a head-to-toe assessment of the patient, and that includes all of the systems from head to toe. So here in your textbook it shows you body structure by body structure and what the physician is actually looking for, what the normal findings would be and the abnormal findings would be. So just looking at a few of these that might catch your eye. In the ears, we're going to be using what kind of instrument to look into the ear. That's going to be an otoscope. In order to look into the eyes, what kind of instrument are we going to use? It's going to be an ophthalmoscope. So with those instruments, we're able to see inside of the actual organ or the cavity in order to assess that, going through and looking at all of the other structures that the physician is going to examine. He or she is going to make mention of, are things in good range of motion? Do they appear nice and pink, meaning they have good blood flow? As you see over on the heart, you're looking for more than just is the heart beating, but we're looking for sounds. Is the rhythm regular? Are they perfusing well throughout the body? You even go down to the feet and assess if there's good circulation down in that area. So moving into the parts of the exam, remember there are 4 major parts of the exam. You have inspection, where you're going to be looking for things, and then you have palpation, where you're actually using your hands to touch and feel. And with the palpation part, this actually breaks this part of the exam down into 2 portions, meaning the light palpation and deep palpation. Most of the time the physician is going to use light palpation unless they're moving to do like a bimanual pelvic exam, where they would actually use deep palpation. Then there's percussion, where we're actually tapping to see if there's some different sounds that come from areas like the lungs and the abdomen. And then of course our favorite, auscultation, which is where we're listening, and we use this one very frequently ourselves, where we measure blood pressure and assess that in our screening process. And one thing that they point out to you here in the textbook, and I want to make mention of as well, is before you use your chest piece on your stethoscope, make sure that you use an antiseptic wipe to wash that with and then warm it up. It's not fun whenever you get a cold chest piece applied to your bare skin. Typically will make your patients kind of jump around and not like you very much after that point. And moving on, how do we assist the physician? Well, to begin with, we're going to be in there and we're not going to know exactly what to expect as a student doing your practicum, but it becomes very easy the more that you go in with your physician to do these exams, what instrumentation they typically use, what order that they go in order to do that exam, things that you want to have accessible to you and the physician if they like to grab instrumentation to use, or if they would rather you hand things to them. But your exam room needs to be kept in a clean and organized fashion, but you also need to have things very accessible to you. You need to be able to face your patient and talk to them and not at them, and you want the physician to have that same opportunity as well. But we're going to be handing off instrumentation to the physician as they need it, and then disposing of the disposable things and cleaning the things that need to be sterilized or sanitized or autoclaved. We might not have a lot of that kind of stuff during a regular exam, but we very well could. Got a lot of disposable things like a tongue depressor or tongue blade, as we like to say. The otoscope tips that we use to look into the patient's ears. Make sure you throw those away. Those are not reusable. And just make sure they're not laying around in the exam room. That doesn't give your patient a good sense that you are organized and clean if you have used otoscope tips laying around, and that's one of the common things that you see. But making yourself available to your physician and anticipating their next move, that's the best way to get in there and be prepared to assist your physician with that exam.